This is NDTV, and you're watching NDTV 24/7.
Hello and welcome. You're watching Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Endocrine glands produce and secrete hormones that are responsible for many important body functions. It plays a vital role in whether or not you develop diabetes, thyroid diseases, growth disorders, sexual dysfunction, and a host of other hormone-related disorders. Thyroid hormones play a key role in a number of body systems, but how much do you know about the gland that holds such a large responsibility for your health? Now, thyroid dysfunction over time can result in obesity, in joint pain, infertility, and heart disease. This disorder affects people of all ages, and today, May 25th, is World Thyroid Day. It's not you, it's your thyroid is the theme of this year's Thyroid Awareness Week. And with this theme, Thyroid Federation International wants to make it clear that thyroid disorders lead to symptoms that are often misinterpreted by those affected. Our experts will provide medically accurate and actionable advice to help prevent the development of thyroid disorders, as well as guide our viewers with effective long-term management strategies. So we're now joined by Dr. Balram Sharma, professor and consultant endocrinologist, SMS College, Medical College and Hospital, Jaipur. Dr. Sanjay Kalra, president-elect, South Asian Federation of Endocrine Societies, Bharti Hospital, Karnal, and Professor Sarita Bajaj, president, Indian Thyroid Society, former director, professor and head, Department of Medicine, MLN Medical College, Prayagraj. Thank you so much, doctors, for joining us on the program and on this day today. Now, Professor Bajaj, I'd like to start with you. A person can develop problems if their thyroid overproduces or underproduces hormones. What is hyperthyroidism? How common is it?
Thank you, Gargi. Hyperthyroidism is sustained overproduction of thyroid hormone and release of this hormone from the thyroid gland. In other words, an overactive thyroid. It can have a wide range of manifestations, from the skeletal system, that is the bone, to the vascular system, that is your heart. It increases your metabolic rate, in other words, your pulse rate, as well as your temperature. The prevalence is 1%, which is much less than hypothyroidism, which is the most common thyroid disorder, at 4.6%.
Right. Dr. Kalra, if you could tell us, what are the causes of hyperthyroidism?
Thank you. That's a very important question, because until we don't know the cause, we won't be able to manage it. Now, the most common cause of this disease is an autoimmune condition. Immunity means something that we use in our body to help fight foreign infections, insults that are coming from outside. But sometimes the body begins to fight itself. Just like in football, you end up scoring a goal against yourself. Or in cricket, you end up running out your colleague instead of fighting against your competitor. That's what happens in the thyroid in Graves' disease. The body begins to fight itself and the gland becomes hyperactive. At other times, nodules or small masses form in the gland, and they can begin producing excess thyroid hormones without any control from the pituitary gland. So this too can cause hyperthyroidism. Very rarely, you may have patients who ingest a lot of thyroid hormone, and this too can cause hyperthyroidism. Even more rarely, there might be a cancer somewhere in the body, somewhere else apart from the thyroid, which releases these thyroid hormones and then causes hyperthyroidism.
All right, Dr. Sharma, now if you could tell us, it's been talked about how people often don't detect their thyroid issues. What are the symptoms then of hyperthyroidism?
Yeah, so that is really very important, because whatever knowledge do you have about the disease, and if you are able to diagnose by yourself, or if you are able to have this suspicion about the disease in your colleagues or in your near and dear or relatives or yourself, then that will be definitely accurate policy, because at the right time you can have the intervention or help of the doctor. So the hyperthyroidism, as Dr. Sarita Bajaj also mentioned, that this is because of the increased metabolic rate in the body. So that ultimately lead to the palpitation, sort of weakness. You are losing weight despite increase in the appetite. You might be going for multiple time to pass your stools, or your stool frequency might be increased. You might have less sleep, or the heat intolerance is there, means you are not able to tolerate heat in comparison to your family members or other persons in the family. So you are feeling nervous, you are having irritability, you are having sweating, you are having tremors in the body, like at normal time you are having the tremors. So these all are the symptoms. The other symptoms, like sometimes the patient might have the protruding eyes, which is called the proptosis. So that might also one feature of hyperthyroidism. In addition, sometimes the goiter might be increased here, and the thyroid might be enlarged, and this is called goiter. So these all might be the symptoms. The patient might lose weight significantly. In few months of span, the patient may lose a few kgs, right from 5 to 10 kg of the body weight loss might be there without any other noticeable cause, despite having increase in the appetite. So these are the dominant features or prominent features of hyperthyroidism, and if you have any of them, you can have the suspicion that you might be suffering from hyperthyroidism, and you can contact your endocrine doctor.
All
Over
right.
to you, Gargi.
Right. Professor Bajaj, then how does the incidence of hyperthyroidism vary between males and females?
Sanjay just told us that it is autoimmune, the most common disease, that is Graves' disease. All autoimmune disorders are more common in women. So women have more of hyperthyroidism as compared to men, 1 to 2% in women compared to 0.1 to 0.2% in women. So thinking of the risk factors, being a woman per se is one important risk factor. The other risk factors are genetic susceptibility. In other words, if you have a strong family history, if you are taking more of iodine, it can be in medications or it can be in your diet, or you can have some associated conditions which make you more susceptible, like type 1 diabetes, adrenal, there's an adrenal gland which sits on top of the kidney, 2 adrenal glands on top of both the kidneys, which produces adrenal hormone. If there is adrenal insufficiency, which we call Addison's disease, that is also one of the important risk factors for hyperthyroidism. Pregnant women, pregnancy is also a very, very strong, let's say it makes you more susceptible to hyperthyroidism.
Right. Dr. Kalra, now if you could tell us which thyroid function tests are performed to diagnose hyperthyroidism, so our viewers can understand this better.
So like Dr. Balram said and like Dr. Sarita said, you can suspect hyperthyroidism based upon the complaints that the patient has. But finally, to confirm it, you need to diagnose. So we need a panel of tests. The 3 basic ones are T3, T4, and TSH. T3 means triiodothyronine, and T4 is thyroxine. These are hormones that are secreted from the thyroid gland, and obviously they will be high. In most patients, the TSH will be low. TSH means thyroid stimulating hormone. That comes from the pituitary gland, from the brain. When the brain gets to know that the thyroid gland is hyperfunctioning, it's working very hard, then it relaxes and the TSH comes down. There will be very, very few patients where you might have a high T3, a high T4, and a high TSH. That can be in some cancers. And if the level is not very high, it might be obesity as well. It might be just because of overweight. It might be because of taking oral contraceptives. When you are confused, then you sometimes have to do a test known as TRAB, TRAB, TSH receptor antibody test. This TRAB test tells us whether the disease is autoimmune or not. If TRAB is high, it means it's Graves' disease, it's autoimmune, and we have to treat for a long time. We can use TRAB to monitor the quality of our treatment as well. And sometimes we use it to decide when to stop therapy, when to stop treatment. So these basic tests, a T3, T4, TSH for everyone, done at regular intervals, and a TRAB done for some people sometime. Very rarely we might order an ultrasound of the neck we might order a test called fine needle aspiration cytology. But these are not done routinely, and they will be done only if we are confused with regards to the diagnosis.
All right, and so Dr. Sharma, now if you can come in here and tell us about the treatment options if one is diagnosed with hyperthyroidism, one has seen they have the symptoms and has tested for it. So take us through what are the treatment options?
Okay, so colleagues, if you have the suspicion or if you have diagnosed with hyperthyroidism, then don't get afraid. Now with modern medicine, we have a lot of treatment options to treat it perfectly and completely. So to start with, there are two type of main treatment, and third one will be the permanent auto. So initially we try to control the symptomatology. So there are few medications which will help in the improvement in the symptomatology, like in the tremors or less sleep or the palpitations or anxiety or heat intolerance. Then the medication which are targeted to decrease the thyroid hormone productions. So we have the medications known as carbimazole, propylthiouracil or methimazole sort of medications are there, and by the help of the test as advised by Dr. Kalra sir, so we can perfectly control it with the proper medication. Nearly 50 to 60% of the patient can be controlled properly on or permanently with these medical options. But in few of them, we might need the complete treatment options like surgical options or the radioactive iodine ablations. So if somebody is not having control properly, or if he has the relapse once you have stopped the medications, then you can try these two options available, and both of those are safe options. So most of those have been controlled properly with the radioactive iodine therapy, or the thyroid surgery also can be tried in few of the patient if the things are not suitable for these two initial treatment options. But by these all three options, we can perfectly control the hyperthyroidism and the patient can live a normal life. So there is nothing to worry about that.
All right, so that's reassuring to know. We'll slip into a short break now, doctors, and return with more questions. Stay with us. Welcome back. Today is World Thyroid Day, and we're talking about how to detect thyroid issues and ensure you remain healthy. Let's go across to our doctors now. And Professor Bajaj, to you, what are the complications if you don't get treated for hyperthyroidism?
Yeah, so I think Balram has put it very nicely that we have excellent treatment modalities today, but nevertheless, if complications come, then the first and foremost would be atrial fibrillation. Atrial fibrillation is an irregular beating of the heart, or what we call arrhythmia. So because of that, you get a clot formation in the heart, and then those clots are thrown out into the circulation. It can impact your lungs. It can be, again, a very serious complication. It can impact your brain, giving rise to a stroke. Patients can have heart failure or other heart-related complications. Thyroid eye disease. We are talking of Graves' disease. Sanjay referred to that. Graves' disease is one of the most important causes of hyperthyroidism. It can cause thyroid eye disease. Thyroid eye disease can be mild, moderate, severe. So apart from just bulging of the eyes, to excessive watering, to light insensitivity, to double vision, it can be sight threatening, so you can lose your sight as well. It is prevalent in only about 0.4%. Osteoporosis, that is weakening of the bones. If it is there in pregnancy, it can have deleterious consequences for the mother and for the child. And if it is not detected, not treated, under certain circumstances, in certain individuals, you can have the life-threatening thyroid storm in which your body temperature, your respiratory rate, your pulse goes up tremendously. So these are the complications of hyperthyroidism.
And speaking more about these complications, Dr. Kalra, why do you see bulging eyes in thyroid disease, and how does one protect the eyes in thyroidoxicosis?
Like Dr. Balram and Dr. Sarita have said, there are multiple ways in which you can suspect hyperthyroidism. and which you can feel that the patient is suffering from hyperthyroidism and its complications. But there are three main signs in the disease. The first is a neck sign, where you have a swelling of the neck. The second one is a skin sign. You might have skin lesions over the legs. And the third, which is most prominent, which is what helps us diagnose the disease, that is eye signs. But you should be able to diagnose the disease and treat it before damage occurs to the eyes. What happens in hyperthyroidism is that there is a deposition of material, protein material, behind the eye and within the muscles of the eyes. That makes the eyes protrude out, stand out. So you will see a very large kind of eye, a very staring eyes. This can be considered a sign of beauty by some, but it is actually a sign of disease. This increased mass of tissue behind the eyes pushes the eyes forward, and it predisposes the eyes to damage from the environment. So how can you prevent damage? First of all, diagnose early, and then treat early. Begin treating hyperthyroidism in a timely manner. Secondly, blink your eyes regularly. So do remember every 20 minutes to blink 20 times. This is especially important for persons who spend a lot of time on the screen, on TV, on their mobiles. If you keep on staring at the TV regularly, you forget to blink. If you keep on staring at the computer screen, again you forget to blink. And that makes the eyes weak. It damages the eyes. That's why you see in NDTV, every 15 minutes we have an advertisement so that you can blink your eyes. So let's blink once. And
in fact, I'm blinking my eyes right now, doctor, as you're saying that, I'm blinking my eyes just to rest them in the middle of this show. But Dr. Sharma, if you could tell us about diets now, what are the dietary modifications for hyperthyroidism? Can iodized salt cause hyperthyroidism and hypertension?
Yeah. So actually, the relationship between the iodine supplementation and the thyroid disorders are actually U-shaped. So on one side, previously, like in the various parts of the world, including our country, particularly in the hilly area, there was iodine deficiency, and that is one term which is commonly known as the endemic goiter. And a few years or a few decades ago, I can say that you used to see a huge size of goiter, which was large enough, which you can see from even 100 meters or even more than that. So that was one entity. But once the universal iodization of salt program was initiated in our country and in other countries also, where various other modalities of fortification of salt were used, including iodized salt, so that entity actually disappeared from most of the part of the world, including our country. But there are reports where we have seen from different parts of the world that once you are on higher side of intake of iodized salt or iodine, then the things might be on other side also, like with increase in the iodine intake, the normal recommended intake of iodine is actually 150 microgram daily. And if you are crossing the limit of 300 microgram daily, then the things might be in the unfavorable side. And similarly, there are reports in the scientific media, just a few minutes, just few seconds, that if you are taking more iodine, then the hyperthyroidism or the thyroid nodules, or sometimes there are reports that even the thyroid malignancies might be associated, although the reports needs to be confirmed with future reports. So we need more data, but there might be some relationship.
Right. Now, finally, since it is World Thyroid Day, I'd like to get, closing remarks from all of you, starting with you, Professor Bajaj. If, you can tell our viewers, what is the message that you'd like to share with them?
Thank you. Thank you for bringing that up. You've already told us the theme. World Thyroid Day is actually a week. So from May 22nd till 28th May, it's a whole week. And today is World Thyroid Day. The theme, it's not you, it's your thyroid. It's the whole aim of World Thyroid Day is to create awareness, that is public awareness as well as amongst healthcare professionals regarding thyroid disorders. So my message would be that take care of your thyroid, which will then take care of your overall health. It's a very, very important disease.
That's right. I'd like to, and brief messages now. Dr. Kalra, you?
Do take the opportunity to screen yourself for thyroid disease. And at certain phases of life, everyone must be screened. When you are born, screening is a must. At the time of puberty, when you are planning pregnancy and during pregnancy, screening for thyroid is mandatory. Also at menopause or at mid-age, you must screen yourself. If you happen to have a family history of thyroid disease, and if you happen to be consuming non-iodized salt, do screen yourself more frequently. Health is in your hands. Be aware of it. Be thyrovigilant.
And final word to you, Dr. Sharma, your message today?
Yeah. So as Dr. Kalra mentioned about the thyrovigilance, so this program is actually also dedicated to increase the awareness. So my message to my colleagues and friends and patients is that if you are diagnosed with thyroid disease, don't get worried, don't get concerned, or don't get scared. We have the treatment options which are suitable to you, which are safe to you, and which are perfect to help you in proper ways. So once you are diagnosed with thyroid disease, any sort of either hypothyroidism, either hyperthyroidism, either thyroid nodule, or even the thyroid malignancy, most of them are treatable, curable, most of the time in perfect manner. So don't get worried. You will be all right. Thank you.
All right. Thank you so much, doctors, for speaking to us on this very, very important issue and creating this awareness. Thank you all for watching as well. Goodbye.